Hello, my name is Melina Portman, and I'm the student pharmacist here today. The patient we are discussing is AJ, who is a 37-year-old African-American female. She complains of fever, cough, fatigue for 5 days and is gradually getting worse to the point where she is unable to coach her daughter's soccer team. Her past medical history is asthma, hypertension, and seasonal allergies. Her family history is not pertinent at this time. She's a non-smoker who drinks 4 glasses of wine a week and denies any illicit drug use. Her medications include calcium carbonate, or Tums, 1,000 milligrams twice a day by mouth, a atenolol 50 milligram tablet by mouth daily, prenatal multivitamin 1 tablet daily by mouth, ProAir HFA 0.09 milligrams, metered dose, inhaler as needed every 6 hours, Brio Ellipta, 100 micrograms per Acua daily, 120 fluticasone propionate inhaler, 0.05 milligrams. Her allergies include penicillin, which she gets diarrhea, and latex, which she has a rash. Her immunizations are up to date, including the flu shot this past October, and Pneumovax 12 years ago, and then she did get her COVID shot with booster, and she had Pfizer. She is positive for chills, fatigue, fever, malaise, congestion, cough, sputum production, short of air, wheezing, has chest pain, palpitations, and myalgias. She is alert and oriented ×3. She is tenderness to palpations, and effort is normal with normal breathing and no wheezing or rales. For the assessment, she has pneumonia and hypertension and asthma, but the hypertension and asthma is controlled. Her vital signs include a temperature of 101 degrees Fahrenheit, a pulse of 83 beats per minute, respiration 16 breaths per minute, 128/72 blood pressure millimeters of mercury, and a pulse ox is at 98% on room air. Her serum creatinine is 0.9 milligrams per deciliter, and she does have an increased white blood cell count of 13,000 cells per milliliter. All of her other labs are within normal limits, and she does have a negative COVID and flu test on file. Her creatinine clearance is 92 mLs per minute. Her BMI was calculated at 21.6 kilograms per meter squared, and her height is 70 inches and weight is 150 pounds, with her blood urea nitrogen being 8 milligrams per deciliter. Her chest x-ray shows consolidation in the right lower zone, and she is diagnosed with right lower lobe pneumonia. The evidence to support this diagnosis is her increased white blood cell count and temperature shows that she has an infection, and the chest x-ray also shows that she is having pneumonia because of the results from the consolidation in the right lower zone. The plan is going to be to eradicate the pneumonia infection of the right lower lobe and prevent any further spread of the infection. The guidelines that I used today were the IDSA Diagnosis and Treatment of Adults with Community-Acquired Pneumonia guidelines. Since AJ has pneumonia, we did a CURB score to see if she should be treated inpatient or outpatient, and if it's non-severe or severe. So CURB stands for confusion, urea, respiratory, blood pressure, and 65 if she's over 65. So she scored a 0 on the CURB score, so we can classify this as non-severe pneumonia. And she can be treated outpatient and at home. But she does have comorbidities, so the therapy options include combination of amoxicillin clavulanate or Augmentin, or you can use a cephalosporin plus a macrolide or doxy, or a fluoroquinolone as monotherapy. So for the recommendation I gave today, I chose to use cefuroxime 500 milligrams by mouth twice a day, and azithromycin 500 milligrams for the first day, and then 250 milligrams daily after that. The treatment will last 5 days, and for the monitoring, we want to make sure that she monitors and is aware of sun sensitivity. So make sure that she wears sunscreen if she's going out, or just try not to be in the sun. And then also beware of tendon rupture. So make sure that she's being safe and not being too rough or doing anything while she's on the antibiotic therapy. Some safety monitors include QT prolongation, GI, rash, and anaphylaxis. And then we want to counsel her to separate the calcium carbonate and the multivitamin from the antibiotic therapy by at least 2 hours to avoid chelation. And then we want to monitor efficacy based on the improved respiratory symptoms and a follow-up for 4 to 6 weeks to do another chest x-ray and draw any labs. And that is all the information I have for you today. What further questions do you have for me?